Zimbabwe's health minister, as we mentioned earlier on, Obadiah Moyo, says the death toll from a malaria outbreak continues to increase. He said on Tuesday the toll now stands at 152. Now, Dr. Fortune Nyamande is the spokesperson for the Zimbabwe Association of Doctors for Human Rights. He's on Skype and he joins us now from Harare. Dr. Nyamande, thank you so much for joining us. Warm welcome to the Globe.
Oh, thank you.
Just how serious is the malaria outbreak and how badly does it compound the problem of fighting COVID-19?
Okay, thank you. I think the malaria burden currently is rising. From the statistics that we get from the ministry, they are saying that from January, we have witnessed about 170,000 cases of malaria and about 152 deaths. So this is actually about 40% more than the number of cases that we normally witness during this same period as compared to last year. And also the number of deaths has increased by about 20% than what we would normally expect in the same period. So this presents actually quite a lot of challenges in terms of our response to COVID-19. Firstly, there seems to be like conflation of symptoms between COVID-19 and malaria. So it makes it difficult for clinicians to be able to really determine whether a patient is presenting with COVID-19 or a patient is presenting with malaria. Then secondly, the health personnel who are at the moment trying to battle the challenges from the COVID crisis also need to be working on responding to malaria. And maybe partly that is why we've actually seen the increase in the number of deaths, because ordinarily our system should have responded and contained the malaria outbreak.
It really is concerning. I mean, what factors would you attribute the surge in cases to?
There are quite a number of factors that you can attribute this to. Firstly, I think as what is happening globally, we are witnessing an increase in temperatures due to climate change globally. So we'd expect the incidence of diseases like malaria to be going up. Then secondly, if we analyze the data, one of the provinces that is heavily affected by malaria in Zimbabwe currently is Manicaland province, which is a province which witnessed some flooding last year. So most of the people are actually staying outdoors because their housing infrastructure has not yet been rehabilitated. So the traditional approaches that we've used, like bed nets and indoor residual spraying, is probably not effective because these people do not have decent housing where they can sleep. Then finally, during this period, what we also see is we're coming to the end of our rainy season and most people are harvesting their crops. So during this time of the year, people normally sleep outside their houses as they are trying to harvest their crops. This then also makes indoor residual spraying ineffective and other approaches like bed nets also ineffective.
No, Dr. Nyamande, some countries in the African region have developed malaria elimination plans, which includes the interruption of local transmissions of a specific malaria parasite species to a particular geographic area. Is that the approach that health authorities are adopting?
Yes, definitely. In Zimbabwe, there have been some provinces where we are actually now moving towards elimination of malaria in certain provinces. But however, I think we witnessed quite a lot of changes in 2015, 2016, where our malaria incidence had really gone down. But we've seen a resurgence of the cases of malaria. And I'm not sure if our plans to eliminate malaria in certain provinces are still on track.
So what is your assessment then of those carrying out the testing or rather vector control strategies such as indoor residual spraying in those communities? So what's your assessment of taking the precautions that have to be taken with regards to containing the spread of coronavirus? Because Zimbabwean health authorities have complained the lack of PPEs in Zimbabwe. Are you seeing those personnel who go door to door in preventing malaria wearing the same masks that are supposed to be worn?
Yeah, I think that's a serious challenge that we have. I'm the chairperson of the Zimbabwe Association of Doctors for Human Rights. which is the organization that took the government to court to make sure that all health workers in Zimbabwe are given PPE as they are conducting their duties. So the shortages of PPE is a big problem, not only for the workers in the central hospitals or in the private practices, but also, as you rightfully mentioned, in the community health workers and the village health workers, who are central in terms of our response to malaria. You know, the village health workers, they are the ones who really move around the communities and implementing most of the malaria containment strategies that we've mentioned before. We believe that they do not have access to adequate PPE facilities. You can imagine that if a doctor at a central hospital cannot have PPE, what would then happen for a village health worker who's working in the community? So these village health workers who are helping us respond to malaria are in danger of contracting COVID because they are trying to contain the twin burden of malaria and COVID-19 at the same time. So we really do urge the government to move in and the other development partners to move in speedily and, if possible, find a mechanism that we can provide PPE to these frontline village health workers.
Taking into cognizance that the financial gap for malaria programming shrank by a considerable magnitude, and at the same time we're seeing a surge of malaria infections and deaths in Zimbabwe, is this an indication that Zimbabweans should brace themselves for more deaths?
Ordinarily, our system has been saddled with a crippling financial shortages, financial underfunding. As we are aware, the government of Zimbabwe has over the years allocated less than 10% of its budget to healthcare. So most of our budget to respond to malaria has been largely dependent on funding from donor partners. So we think that if there are no urgent measures that will be put in place to contain the current malaria outbreak, we may inevitably have more deaths in malaria. And more worrying, we know that this will affect women and children more disproportionately as compared to the general population. So we really do urge the government and development partners to really sit down and find a way of coming up with an innovative way to fund our response to malaria, to avoid the possible loss of life, as you rightfully say.
And how does the government fund that? How does the government, take into consideration the fact that the country's economy is already on its knees and it is now channeling the little resources it has in fighting coronavirus? So how does the country fund the fight against malaria?
I think there's a need to look into the funding of the healthcare system in a more holistic manner. What we've been seeing are more of knee-jerk reactions by the government to try and mobilize resources to spruce up a health system that has chronically suffered from underfunding over the years. So what we urge the government to do is to really take up a holistic approach in terms of funding the health infrastructure, to motivate the health workers, to come up with ways, for example, of increasing capacity utilization in our giant pharmaceuticals so that we can have production of drugs at a local level. So we think that it's possible. Yes, Zimbabwe is facing quite a lot of challenges in terms of funding, but we still think that the current few resources that are there are not being used wisely. We see the government spending more on non-essential ministries like the Minister of Defense or the Minister of Home Affairs. Those resources can be reallocated and spent on health sector because as we stand right now, we have got this twin crisis of COVID-19 and also the malaria outbreak in various regions in Zimbabwe. It's possible for the government to realign its budget and put more money to the health ministry so that we respond to the crisis that we have at the moment.
All right, Dr. Fortune Nyamande, the spokesperson for the Zimbabwe Association of Doctors for Human Rights, joining us via Skype. Thank you so much for your time.
Thank you so much.